Hi. I'm robo-Suzie and today I'll talk to you about hemorrhoids, diagnosis and symptoms. Also don't forget to check out the link below, for the most comprehensive, multifaceted program for fixing hemorrhoids. It has a very high success rate. But back to our topic. Hemorrhoids, also referred to by the more antiquated term piles, are a condition when the veins around the rectum become swollen and tender. It can be embarrassing to discuss, even with a doctor, but keep in mind that it is a very common problem. Although a lot of people have hemorrhoids, not every person will experience symptoms. The most general symptom of internal hemorrhoids can be blood covering the stool, on toilet paper, or in the toilet bowl. In more severe cases, internal hemorrhoids can protrude from the rectum, becoming swollen and sore. This is called a prolapsed hemorrhoid and it is a potentially more serious condition. It's estimated that above 3/4 of all people in the US will experience hemorrhoids at some period in their lives, with occurrence become more prevalent as we age. The most common age people begin having trouble with hemorrhoids is from 45 to 65 years old. Pregnant women also experience a higher rate of hemorrhoid problems. Internal hemorrhoids, or those that located inside the anal cavity, ordinarily bring about painless bleeding after a bowel movement, but any anal bleeding can be a sign of a more serious medical problem, so it is crucial to consult a doctor. External hemorrhoids can usually be both seen and felt as a small protuberance close to the rectum. External hemorrhoids usually cause patients more problems and symptoms than internal hemorrhoids because of the simple fact that the hemorrhoid is not protected inside the body, as in the case of internal hemorrhoids, and it then becomes subjected to daily stress. External hemorrhoids ordinarily produce signs of tenderness and itching when swollen. Internal hemorrhoids are normally painless but may result in bleeding. While hemorrhoids may bring about rectal bleeding, if you exhibit bleeding, don't just guess that it is hemorrhoids, because some types of tumors or other more serious health problems can also be the cause of rectal bleeding. So you need to consult your health professional to eliminate any other health concerns. Some anal or ectal problems, including fissures, or anusitis, may produce similar symptoms and are regularly incorrectly referred to as hemorrhoids. Some conditions that may affect the rectum and colon can also produce bleeding, irritation, and pain, but nearly all people who suffer one of these signs automatically assume they have hemorrhoids, however frequently they don't. That's why a doctor's exam is so essential, even for something as seemingly inconsequential as hemorrhoids. When bleeding or other anal problems occur, your doctor most likely will urge a colonoscopy. This exam allows your health professional to inspect the inner lining of your rectum. A narrow, flexible tube is used to inspect the large intestine. A colonoscopy can help to locate not just hemorrhoids, but also ulcers, anal problems, and cancer. During a colonoscopy, tissue samples may be taken and then screened for malignancy or precancerous cells. Remember, ahead of this colonoscopy, you will need to clean out your colon. This colon prep could take 1 or 2 days, dependent on what the doctor prescribes. A few preps can be taken the evening before your procedure. For most sufferers, the prep for this examination is more difficult than the real colonoscopy. Get organized for staying at home all through your prep time, since you will have to use the bathroom frequently. Also, the prep causes loose, frequent stools, so your colon should be clear for the test. The prep may well be disagreeable, plus you could feel hungry on the liquid diet. Should you have to take a special solution as part of your colonoscopy prep, make sure you get masses of soft drinks standing by to consume following the prep liquid, since it tastes foul. Commonly, hemorrhoids are not hazardous, and in nearly all cases, hemorrhoid symptoms should disappear within a few days if treated properly. Generally, hemorrhoids can be treated with changes to lifestyle and bowel routine. Commonly, hemorrhoid relief does not rely on surgery unless the hemorrhoids are very sizable and causes the patient a lot of discomfort. The aim of non-surgical methods to cure hemorrhoids is to decrease the existing blood supply going to the hemorrhoid so it will shrink and disappear. The scar left in its place helps support the anal area and helps prevent other hemorrhoids from forming. These non-surgical methods can include tying off the hemorrhoids with a rubber band or utilizing heat to create scar tissue. Otherwise, surgery can be necessary for larger hemorrhoids, If a patient has many hemorrhoids, or if other treatments have not worked. Sometimes a mixture of treatments, for illustration, a non-surgical procedure together with dietary modification may be the most effective method to cure hemorrhoids. For most people, hemorrhoids are caused by excessive straining in the course of bowel movements, especially with constipation. Pregnancy, lack of exercise, and some medical conditions may be additional causes of constipation, which then may lead to hemorrhoids. The best way to alleviate constipation is through lifestyle changes such as adding extra fiber to your normal meals, drinking a lot of water, and staying fit. For pregnant women, hemorrhoids can be a familiar problem caused by hormone changes together with increased pressure by the developing fetus. In pregnancy, the major reason for hemorrhoids is constipation. Excessive straining when moving your bowels can place increased pressure on the already stressed veins, so if you experience regular constipated during pregnancy, you may want to consult your doctor about obtaining a mild laxative. The best thing to do may be to dodge being constipated at the start by drinking a lot of water together with regularly eating a number of foods that are rich in fiber, for example fruits and whole grains. When pregnant, you will probably have to have a day or more of staying in bed to lift weight off swollen, irritated anal veins. Once you're between 3 and 6 months pregnant, you will probably find it most comfortable to lie down on your side. For those who are currently not pregnant, sleeping on your stomach with a cushion under your hips can assist in reducing the swelling of hemorrhoids. In addition to preventing constipation, here are some additional tips that may help with hemorrhoid treatment and reducing symptoms. Keep the anal area as clean as possible. Using medicated wipes may be more soothing than regular toilet paper. Try to avoid sitting and standing for prolonged periods of time, which can place stress on internal hemorrhoids. In addition, when you sit, an inflated donut or nice pack may provide some relief. Use soaps that contain no perfumes or colorings, as these may irritate symptoms. If you try these simple steps, but your hemorrhoids grow more painful, you may need to seek a surgical solution, but keep in mind that in most instances, hemorrhoids are a very minor health concern and if treated properly can be eliminated altogether. That's it. Thank you. Please subscribe, comment and like this video if it was helpful. See you soon.